Every year on October 1, the ICD-10-CM code set gets its annual refresh. These important coding updates include new codes, revised codes, and coding descriptors, and deleted codes. Diagnosis coding updates directly impact how providers document, coders assign diagnoses, and payers process claims. ICD-10-CM HCC mapping is the process of translating specific ICD-10 diagnosis codes into hierarchical condition categories, HCCs, for risk adjustment in Medicare Advantage, using a crosswalk to group diagnoses and assign risk scores, RAF scores, that predict patient healthcare costs and adjust payments to health plans, ensuring providers are reimbursed for complex patients. This system ensures that healthier patients have lower scores and sicker patients, requiring more resources, have higher scores, reflecting the true cost of care. Payment Year 2026 mid-year/final version of CMS-HCC model is available at the CMS site. It is integrated to Medicare Informatics Risk Adjustment Tool. In this video, we would like to share how ICD-10-CM HCC mapping has been changed in Payment Year 2026 mid-year/final version of CMS-HCC model. Payment Year 2026 CMS Hierarchical Condition Category Risk Adjustment Model. For non-PACE organizations, CMS is completing the phase-in of the 2024 CMS-HCC model as proposed in the Payment Year 2026 Advance Notice by using 100% of the risk score calculated using the 2024 CMS-HCC Risk Adjustment Model, version 28. For PACE organizations, for Payment Year 2026, CMS will begin phasing out the 2017 CMS-HCC model as proposed by calculating risk scores as a blend of 10% of the risk score calculated using the 2024 CMS-HCC Risk Adjustment Model, version 28, and 90% of the risk score calculated using the 2017 CMS-HCC Risk Adjustment Model, version 21. The CMS-HCC version 28 model is a new risk adjustment model that is being phased in over 3 years to replace the current version 24 model. During this transition, risk scores are calculated using a blend of the version 24 and version 28 models. In 2024, 67% of the risk score is based on version 24, and 33% is based on version 28. In 2025, the blend is reversed, with 33% based on version 24 and 67% based on version 28. By 2026, the version 28 model will be fully implemented, with 100% of risk scores calculated using it. In Medicare Advantage, the normalization factor is a crucial adjustment applied to risk scores to ensure the average risk score for the population is 1.0. It's calculated to reflect the expected growth or decline in risk scores over time, keeping the average at a standardized benchmark. In the context of Medicare Advantage plans, the normalization factor is an adjustment applied to the risk scores of MA beneficiaries to ensure that the average expected risk score in a given year is 1.0. This factor is calculated by the CMS and used to standardize MA risk scores with those of traditional Medicare fee-for-service beneficiaries. The higher the normalization factor, the lower the adjusted risk score, and the lower the payments to the Medicare Advantage plan. Conversely, a lower normalization factor results in higher adjusted risk scores and potentially higher payments. For Payment Year 2026, CMS calculated the normalization factors using a 5-year multiple linear regression methodology and average historical fee-for-service risk scores from 2020 through 2024. For non-PACE organizations, CMS will continue the policy first adopted for SI 2022 to calculate all risk scores for payment to Medicare Advantage organizations and certain demonstrations using only risk adjustment eligible diagnoses from encounter data and fee-for-service claims. For PACE organizations, CMS will calculate risk scores using 10% of the risk score calculated using diagnoses from encounter data and fee-for-service claims only, under the 2024 CMS-HCC model and the 2023 CMS-HCC ESRD models, and 90% of the risk score calculated using diagnoses from RAPs, encounter data, and fee-for-service claims, under the 2017 CMS-HCC model and the 2019 CMS-HCC ESRD models. In the 2024 Part C CMS-HCC model, coefficients, demographic, disease, disabled/disease interactions, and payment HCC counts, and disease hierarchies are remaining same through 2024 Part C CMS-HCC model supported payment years. Only ICD-10 diagnosis code to HCC mapping table is updated based on ICD-10 diagnosis code annual updates. ICD-10 diagnosis codes are updated annually, with the changes typically going into effect on October 1. Unspecified codes often will not map to HCCs. Without specificity, providers will face missing HCC capture, RAF score loss, and revenue shortfalls. Explore revenue opportunities by requiring specificity, using new and specific codes. It will strengthen RAF accuracy and ensure payments align with members' real disease burden. These are updated ICD-10-CM diagnosis grouped codes mainly focus on 2026 changes from 2025. Find the opportunity to improve risk score using the newly added codes, red font, for specificity. Some parent codes are no longer mapped to HCCs, blue font, and only the most detailed, complete, and specific code must be used for risk adjusted under version 28. Let's go through updated grouped codes one by one in detail. Breakdown of C50A, malignant inflammatory neoplasm of breast. C50A0, unspecified, C50A1, right, C50A2, left. While the new C50A codes are billable for 2026, you should verify the specific version 28 mapping for inflammatory breast cancer, as these codes were recently added to ensure more accurate clinical documentation and reimbursement for oncology practices. These specific codes, C50A0, C50A1, and C50A2, for inflammatory breast cancer became effective on October 1, 2025, for the fiscal year 2026 updates, providing more detailed reporting for this serious diagnosis. These codes are part of the larger C50 category for malignant neoplasm of the breast, with the A extension specifically identifying the inflammatory type. While the new specific reimbursable C50A0, C50A1, and C50A2 codes are available for 2026, you should verify the specific version 28 mapping for inflammatory breast cancer, as these codes were recently added to ensure more accurate clinical documentation and reimbursement for oncology practices. Parent codes, C8339, C860, C861, C862, C863, C864, C865, C866, C880, C882, C883, C884, C888, C889 are obsolete. Only the most detailed, complete, and specific child codes are used for risk adjusted under version 28. Only the most detailed, complete, and specific code is used for risk adjusted under version 28. Do not use the parent code C8339. Only the most detailed, complete, and specific child codes are used for risk adjusted under version 28. Do not use the parent code C860, C861, C862, C863, C864, C865, C866. Only the most detailed, complete, and specific child codes are used for risk adjusted under version 28. Do not use the parent C880, C882, C883, C884, C888, C889. ICD-10 codes D711, D718, and D719 fall under the parent code D71, which signifies functional disorders of polymorphonuclear neutrophils, PMNs, impacting the immune system's ability to fight infection, with D711 being leukocyte adhesion deficiency, D718 other specific PMN disorders, and D719 an unspecified PMN functional disorder. These codes are used in healthcare for diagnosing and tracking conditions where neutrophils, a type of white blood cell, don't function correctly, leading to increased infections and inflammation. These codes help categorize immune deficiencies, often linked to severe infections or inflammatory issues, and are used by medical professionals for billing and tracking patient conditions. Only the most detailed, complete, and specific child code must be used for risk adjusted under version 28. The parent code E340 is no longer mapped to HCC 17, cancer metastatic to lung, liver, brain, and other organs, acute myeloid leukemia except promyelocytic. Must be further specified with codes like E3400, unspecified, E3401, carcinoid heart syndrome, or E3409, other carcinoid syndrome, for risk adjusted under version 28. Only the most detailed, complete, and specific child code must be used for risk adjusted under version 28. Do not use the parent E340. The parent code E7253, primary hyperoxaluria, must be further specified with codes like E72530, type 1, E72538, other specified, or E72539, unspecified, for risk adjusted under version 28. Only the most detailed, complete, and specific child code must be used for risk adjusted under version 28. Parent codes F5001, anorexia nervosa restricting type, F50022, anorexia nervosa binge eating purging type, and F502 bulimia nervosa are no longer risk adjusted under version 28 purposes as there are multiple codes below it that contain a greater level of detail. F5001, anorexia nervosa restricting type, and F5002, anorexia nervosa binge eating/purging type are subcategorized and no longer risk adjusted under version 28 for payment year 2026. F502 bulimia nervosa is subcategorized and no longer risk adjusted under version 28 for payment year 2026. Replace the parent code G35 with specific subcategories. Detailed subtypes are G35A, relapsing remitting MS, RRMS. G35B, primary progressive MS, PPMS, with codes for unspecified, active, and non-active forms. G35C, secondary progressive MS, SPMS, with codes for unspecified, active, and non-active forms. G35D, unspecified multiple sclerosis. Also, new codes differentiate between active, with inflammation, and non-active disease, crucial for advanced therapies. The most detailed, complete, and specific code must be used for risk adjusted under V28. The new 2026 ICD-10-CM code G71036 is a specific code for limb-girdle muscular dystrophy, LGMD, due to Fukudan-related protein dysfunction. It is used for identifying specific LGMD subtypes, replacing the use of unspecific codes like G7100 or G7109. It falls under HCC 197, muscular dystrophy, in 2026 CMS-HCC model version 28. G71036 is newly added in 2026 for limb-girdle muscular dystrophy, LGMD, due to Fukudan-related protein dysfunction, and it falls under HCC 197, muscular dystrophy, in version 28. Over 100 new codes, L984 series, detail non-pressure chronic ulcers by specific site and severity, including abdomen, chest, neck, face, groin, and upper extremities. This is the list of non-pressure chronic ulcer 2026 ICD-10 codes. Starts with L98A11, right upper arm, which are mapped to either HCC 380, through bone to muscle, or HCC 383, not specified as through to bone or muscle. 2026 new code, M05A, abnormal rheumatoid factor and anti-citrulline protein antibody with rheumatoid arthritis, often termed double positive RA. It falls under HCC 93, rheumatoid arthritis and other specified inflammatory rheumatic disorders, in version 28. This code indicates that a patient has tested positive for both rheumatoid factor, RF, and anti-citrulline protein antibody, ACPA, markers. The new ICD-10 diagnosis code M05A is available for abnormal rheumatoid factor anti-citrullinated protein antibodies, especially anti-CCP, in the presence of rheumatoid arthritis, RA. This code is mapped to HCC 93 rheumatoid arthritis and other specified inflammatory rheumatic disorders in the 2026 CMS-HCC Risk Adjustment Model version 28. Until now, healthcare providers had to code cannabis hyperemesis syndrome under vague nausea or vomiting categories, making it harder to track, research, and reimburse appropriately. Providers will now need to clearly document cannabis hyperemesis syndrome in the medical record and select it as the diagnosis code when appropriate. Accurate clinical documentation will map directly to R1116 instead of the nonspecific nausea or vomiting codes. The new ICD-10-CM code R1116 points directly to cannabis hyperemesis syndrome, a recognized complication of heavy cannabis use. In 2026 version 28, it is included in HCC 137, drug use disorder, moderate server, or drug use with non-psychotic complications. The two new ICD-10 codes T36AX2A, poisoning by fluoroquinolone antibiotics, and T65842A, toxic effect of xylazine, intentional self-harm. The intent, self-harm, and that it's the first encounter were newly added to version 28 Hierarchical Condition Category 155, major depression, moderate or severe, without psychosis. T36AX2A is a diagnosis code that stands for poisoning by fluoroquinolone antibiotics, intentional self-harm, initial encounter, used to classify a patient's condition for indicating an overdose or poisoning from a fluoroquinolone drug taken deliberately to cause harm. T65842A is a diagnosis code that stands for toxic effect of xylazine, intentional self-harm, initial encounter, used to classify a patient's condition for indicating the xylazine toxicity, which is a non-opioid veterinary tranquilizer that has been increasingly found in illicit drug supplies. T36AX2A, poisoning by fluoroquinolone antibiotics, and T65842A, toxic effect of xylazine, intentional self-harm. The intent, self-harm, and that it's the first encounter were newly added to version 28 HCC 155, major depression, moderate or severe, without psychosis. The new Risk Adjustment Model Payment Year 2026 Part C CMS-HCC Model, version 28, is added in the Medicare Informatics Risk Adjustment Calculators. It was changed to the default value on January 2026, and new 2026 normalization factor and 2026 ICD-10 to HCC mapping are used for risk score calculation. For details, please refer to the calendar year 2024 and 2026 CMS announcements, which are available at the CMS site.